Let's talk about this Delta variant, can we? It's this new variant that's driving the third wave here in South Africa. One medical doctor believes behavioural change will determine how the next few months unfold. But it's a lot easier said than done. Heartlines CEO and medical doctor, Dr. Garth Japhet, joining us to talk about this. Dr. Japhet, good morning to you. And it really is. A lot of people are criticising government. I've had a number of interviews, and we know there are issues with the way government has handled or not handled a lack of beds, oxygen supplies, vaccinations. We know all that. But to be fair and to be critical, our behaviour has not been exactly exemplary, has it?
No, it hasn't. I mean, I think we've all been lulled into a sense of complacency, and there's a sense of fatigue as well. But the reality is that this is a behavioural disease. It spreads through people, and it's our behaviour that is the key instigator of this. So, yeah, we cannot just say that it's government's fault.
Can we talk a little bit about, before we get to the behaviour, I think so many people want me to ask this question, this Delta variant, I mean, just how much worse is this now? I've just been sent something from a colleague of mine, Heidi Jokos, doctor, I'm sure you know the name. She sent me a tweet, and I've just seen this. So I'm not corroborating this, I'm not confirming this. I'm asking your thoughts, and I know you're unprepared. Dr. Eric Feigl Ding, from what I can see on his Twitter account, he's an epidemiologist and health economist at Harvard, former 15 years there. He's saying 5 to 10 seconds is all one needs to transmit this Delta variant. This sounds like it's an incredibly aggressive strain. What do we know about it?
Yeah, look, I don't know. I haven't seen that. And again, I think what we do know about it is that it is very contagious. It may not be more vicious in terms of the actual disease that it creates, but it certainly seems to be more contagious. So whether it's 5 seconds or 10 seconds, that does sound like a very short time.
It does.
You know, a lot of the evidence around this seems to be sort of 10, 15 minutes, but I haven't seen that. So I would be surprised. And again, I suppose it depends on how close you are, in what context, etc. I think we shouldn't be worrying about things like that. We just know that this is very contagious, and there's certain things that we can do to prevent ourselves getting ill and those around us and those that we love.
Yeah, let's talk about those things we can do, Doctor. Just to attribute this that I was sent, it's according to ABC over in Australia. They're quoting this Eric Feigl Ding, Dr. Eric Ding. So not corroborated, but as we know, information moves so quickly with this. I just want to get your thoughts, but I appreciate the fact that I caught you off guard on that one. But what we're not caught off guard with is tonight's family meeting. Doctor, in the last 2 minutes I have with you, the President is watching. He's found his iPad. I know he watches the show. So what do you tell the President tonight?
Well, I think the President is going to do what the President can do, which is, you know, look at possible major lockdown issues, etc., which is to limit the amount of contact that we have with each other. And yeah, he's got an unenviable job. But there are certain things that we can do, and I think we've got to focus on that. One is information. You know, I think there is, in the Twitterverse, etc., we have got to make sure that the information we're getting, including that tweet that you've just seen, is corroborated, it's valid. There's such a lot of misinformation going around. So look at your sources. Don't just spread rumors. Don't just forward tweets from people until they're validated by really, you know, good authorities. The second thing is example. Leadership is critical, and everybody is a leader, but the more authority you have, the more responsibility you have to lead by example. We are herd animals. We behave as those around us, and the more sort of important people are, you know, church leaders, political leaders, business leaders, we tend to behave according to how we see them. So there's a huge responsibility on us, particularly leaders, and you know, anybody in society is a leader. And as I say, the more authority you have, the more responsibility. And then, you know, unfortunately, you know, people who are not in hospitals are not seeing the devastation of this disease and thinking it won't happen to them, particularly our younger people. This is truly a devastating illness. And this concept that it won't happen to me, we almost need to see, unfortunately, more pictures of what's going on in our hospitals. to give people, fear is not a great idea as a behavior change strategy, but right now, I don't think it's a bad idea that people actually get a real understanding of just how devastating this illness is. So I'd say that, restrictions, yes, information, we need to, please, as I say, I'm very wary of the odd tweet here and there. You have got to check your sources and don't spread information unless you're absolutely certain. And then leadership. We have to, unfortunately, political gatherings, the things we saw outside of SAPRA, those people actually need to be arrested because it is those sort of things that are creating the wave that we're seeing right now.